Hi guys, this is John Adamson, the Rehab and Documentation Guru, doing take 2 on making this video. And I want to talk about the ethics and the medical necessity of treating the bariatric or obese patient. And want to just remind you of the medical necessity definition by Medicare, that you're providing care that is of such complexity, based on the complexity of what you're doing and the complexity of the patient, that only you could safely and effectively do it. So those 3 words, complexity, safety, and effectiveness, correlate with providing medically necessary care. So with that said, let's talk about the bariatric patient and a little case study. So a little while ago, I had a patient who had a BMI of 70. And you might remember the BMI scale. Above 25 is considered overweight. Above 30 is considered obese. Above 40, morbidly obese. This patient was well into the morbidly obese category, and this patient weighed several times what I weigh. So when I went out to see that patient, I explained that one of my goals for treatment was to provide safe and effective care, because that's medically necessary care. And I told the patient up front that if we're going to work on getting you up for transfers and walking, there's no way I'm going to safely guard you. If you start to fall, I'm not going to safely manage you. I'm not going to prevent the fall. And the patient understood that, and I documented that accordingly, that I would not be able to manage them, that the patient was assuming responsibility for falls. Now, I have responsibilities to the patient and not put the patient through something that I believe would lead to a fall. So I was very careful in my administration of mobility with this patient before I felt comfortable with proceeding. So I proceeded with caution. And so one of the principles is, of course, safety. I want to make sure the patient's safe, but in turn, I want to make sure I'm safe. I used to work for UPS. UPS has lifting guidelines for boxes. You're supposed to, if you work for UPS, not lift a box that is greater than 70 pounds by yourself. And let's face it, patients are not as predictable as a box. They can flail about, they can do crazy things. My son, who is in a wheelchair, who's very disabled, he weighs about 70 pounds, and in the midst of transfers, he's sometimes given me a nice right hook to the jaw. Doesn't mean to do it, it's just part of his spastic movement.
Turn right.
So, sorry about the GPS. So anyway, we have to provide a safe care environment if it's medically necessary. But there's also ethical concerns here. And one of the things that the APTA, and I'm sure AOTA and ASHA would agree with, is that you as a clinician are morally obligated to provide only care which you can handle physically. And so the next time you get pressured to mobilize a patient who is bigger than you, and it doesn't even have to be that big, but you realize the patient has conditions or concerns that make it unsafe
In a quarter of a mile,
for you to
turn
be able to
right.
do, don't do it. Not only do you have a moral obligation, like I said, to do only that which is safe, but you also have a medical necessity, Medicare guideline perspective, which is you will provide reasonable and necessary care, and part of that is whether it's
Turn
safe.
right.
And of course, if it's not safe, it won't be effective either. Anyway, this is John Adamson, the Rehab and Documentation Guru. Hoping you have a pleasant day as we finally have some sun here in the state of Virginia. Take care, and God bless.